Cancer facts can save lives. Power up. The Belize Cancer Society is on a mission to increase cancer knowledge and eliminate myths about the deadly disease. And through a wellness ambassador training held today at its offices, the organization is trying to stop or even prevent the disease, which has been increasingly affecting both men and children.
We need to remember that cancer takes a while to develop. So if we adopt healthy lifestyles for the cervix, we can do something about prevention of cervical cancer. We have other risk factors like our genetic makeup, environmental, lifestyle choices, especially if you have multiple partners, you become more at risk, right, to come in contact with these things. So who are at risk for cervical cancers? Your age, especially if your cervix is immature, right? And because we have young people who are having sex so much earlier, they're so immature, they haven't developed. So they become at least more vulnerable in our community.
Cervical cancer has become the leading cancer in women. What causes cervical cancer is really not known. However, it is certain that it is transferred through a sexually transmitted infection that affects men, women, and children.
It is important to know that the cervical cancer is closely associated with infection by the human papilloma virus, HPV. There's a small percentage, about 10% of all cancers that are not affiliated with HPV. Strangely enough, they're associated with things like tobacco smoke and genetic factors and other things. But we are saying, if we have the pap smear that's available in the public sector, we won't talk about the private has it, but the pap smear is available to every woman in Belize in the public sector, free of cost, then that is what we should make sure that everybody knows, that they must walk into that health center at some point and get their pap smear. The later stages has to do with bleeding and discomfort during sexual intercourse, right? Like any cancer cells undergo changes. They mutate, they become uncontrollable. When you do not have a cancer, even if you have something there, you have an inflammation or an infection, it doesn't become a cancer because it can be treated. It hasn't gone into cancer cells. You'll have other symptoms. But the HPV virus and some other factors can produce cervical cancer, and you have a proliferation of cancer cells. It overtakes the good cells, and it's no stopping it unless you stop it.
So how can the media communicate the message of overall wellness, prevention, and control of cancer and other diseases? Longsworth says through efforts which include prevention services offered by both public and private sectors.
We have an idea of the number of persons and the age, the number of adolescents who are engaging in sexual activities and at an early age. And if you understand that because you're immature, your immune system is sluggish, not fully developed, you can see how that young person can get into trouble with cervical cancer by the time they're 20 years old, which is sad.
Prostate cancer and cervical cancer, if detected early, can be managed and in some cases cured. Screening for adults and vaccines for children are available within the country. Dwayne Moody for News 5.